I'm going to start just very briefly. I had a request to talk about COVID testing. So I just want to review that, and then I'll move to the vaccinations. So we have taken a slightly different approach in Calvert than in many other parts of the state in terms of testing. As opposed to having mass testing sites, we acted relatively early to start moving as much of the testing into people's physician offices as possible. And as a result, at this point, every primary care provider in the county, including our pediatric providers, are now capable of doing COVID testing in their offices. Also, our urgent care centers, now all three of them, so Solomon's, Prince Frederick, and Dunkirk, have both rapid and PCR testing, and that's available 7 days a week. So up on the slide, it indicates that in private physician offices, testing is available as many days as they are open. Some are open 5 days a week, some are open 6 days a week, and then the urgent care is 7 days a week. Because of the very limited leftover demand, we still have some service through the health department, very little. So last week, as an example, only 17 people showed up for testing at our health department site, and we had plenty of openings available. Just there aren't that many people who still need additional testing.
Is the results pretty quick, Doc?
Well, the rapid tests are available in 15 to 20 minutes, and then the PCRs are send-out tests, and that takes some time. Although now we have one office, primary care office in the county, who has a rapid PCR test. It took them, I would say, close to 6 months on a wait list to be able to get their machine. Otherwise, it's generally a 2 to 3 day turnaround. For the PCRs are a little bit more accurate, and particularly for people with no symptoms. So if they potentially had an exposure to somebody with COVID, or maybe they traveled somewhere and they're not symptomatic, the rapid tests are probably, and will miss anywhere from about half the infections, maybe even to 2/3. So we generally recommend, if the rapid is negative in those situations, that a PCR test be sent as a confirmation. Okay. And then because I think there's been an overemphasis on testing, and I will quickly hedge that to say that I think testing is extremely important, and the testing should be available for anyone who needs it. But then going beyond a certain point has not been shown to be helpful. So I'll still hear sometimes, for epidemiologists and others, that more testing, but we now have close to a year's worth of data taking a look. And so as is on the slide, when you take a look at the spectrum across the 24 jurisdictions in Maryland, there's absolutely no correlation between the amount of testing done in a county and their positivity levels. And that goes on the upper end of the spectrum for the counties that are doing the most testing, and also goes for the counties that are doing the least testing. If you take a look at any of those, they're all doing sufficient testing. And that is shown because in any of those quartiles, that the distribution around the median, here's your positivity, middle positivity, these are lower levels, these are upper levels. No matter which group of 6 or 10 you take, they distribute equally around that median.
So,
And then,
Doctor,
yes.
then what correlations or assumptions can you draw from that, and looking towards the future of where we are?
So I'm going to flip the next slide, and then I'll answer your question if that's okay.
Sure.
And this also holds for deaths. So when you take a look at the 10 jurisdictions that have the highest rate of testing, they pretty much split between, then you have the median in mortality or fatality rates per 1,000 or per 100,000 people. Those top 10 testing counties, 6 actually have higher than average fatality rates, and 4 are below. And if you take a look at the counties that have the least testing, they also distribute around. And then I put up on the final bullet point on that slide that Calvert County has the second lowest COVID mortality rate in the state. So I just don't want anyone to think that because we are doing less testing than the average in this county per capita, but that should not be confused as leaving people vulnerable. So now, addressing your question, Commissioner Hutchins, that I think it's extremely important that the primary factor in determining is human behavior. And we saw this, and I'll flip to the next slide. So the COVID cases per week, and this is not just indicative of what happened in Calvert. So the slide goes from October 1st through this past week. And what you'll see is starting right around Thanksgiving, as people started getting together for this, that, and the other, the rates started climbing. And then as people got together for office parties and other social functions leading up to Christmas, the rate kept accelerating. The rate accelerated through Christmas. New Year's, there were lots of get-togethers and parties, including for kids. We had lots of contact tracing where we found out that there were sleepover parties for teenagers and for children. And we saw a dramatic increase in the number of cases in children and young teens during that phase. And now that the holidays are over, now we're starting to see the case counts come back down. So you can test all you want, but ultimately what determines transmission is how we behave individually and how we behave as a community. And so the message that I would take from this is that the epidemiologists, it's great, you need to have them, but the most important are the behavioral economists, the people who try to explain why we do things for the reasons that we, the reasons we do. I've lost my in the middle of my phrase, but our motivations for the behaviors that we have. And so my hope is, and a lot of what we have encouraged all the way through since back last spring, was your actions should be respectful of your family members, of your neighbors, that we all do have a collective responsibility. And hopefully, as we move into the spring, we know that vaccines are now becoming available, but still, on average, right now, only 7% of the state is vaccinated, and that continued increase in the percentage of vaccinations is going to be gradual, as we all know, because of the kind of bottleneck as far as production of vaccines. So our behaviors are still extremely important, and I don't want to get too deep into the new variants of COVID unless you want me to, but that also may play a big role in these continued curves into the future of how we see things go up and down. And then on our website every week, we post for the past 4 weeks, not only the number of cases, which is the total to the far right, but we also break it down by age groups. And then you can see for the 0 to 14, there was a significant bump up, almost doubling prior to the, and that only goes back 4 weeks. If you go back before Thanksgiving, more than doubling as you went from early November into the holidays. And still the bulk of the cases are in that kind of mid-age range, 35 to 55.
Doctor, on COVID cases are drawn from what? Are they drawn from testing? Or are they drawn from intake in the emergency room?
So every time someone is tested for COVID, whether they have a positive or negative result, the results go into a state database, and then those results are available to the person's home county. So if a person works in Calvert, but they live in St. Mary's, we don't get that data. It goes to St. Mary's. And conversely, if somebody lives here, but they work in Anne Arundel, we get the data. So we can extract certain things like age. We can extract that. Other things, there's only so much detail within those reports. So then the contact tracing takes place, which is every time we get a report, we make an attempt to contact the person, find out, are they in a high-risk situation? Do they work in a nursing home? What's the issue there? Daycares are a constant source of frustration. And then making sure that we try to contact the people immediately around them so that they can take precautions, they can quarantine as necessary, they can get tested as necessary. But yeah, the data is certainly limited to the reports that we get from the state.
Very good. And if we can talk some more offline, because I see this as directly correlated to the number of testings that we're doing in order to arrive at that distribution and case level. But we can talk some more offline. Today's just, an update for the public.
So Doc, on that, and boy, and I'm really not trying to open up a big door here, but so obviously it seems like distance, right? And that's just common sense, right? If you're not around anybody, you don't catch anything, right? A cold or what have you.
Right.
It looks like we're probably 2 years before we're vaccinated, unless something completely changes. I mean, at this rate,
I think it'll be a shorter time frame than that, but that is dependent on
supply.
Johnson and AstraZeneca vaccines will probably get FDA reviews this month. The Novavax vaccine may get a review within the next month, so it's possible the supply could expand significantly over the next 4 to 6 weeks, but we don't know at this point.
And I heard you mention daycares is where I'm leading here. So if you're mom and dad and you're the school system, how do you address this? I mean, we've seen what the governor has said, but I know sometimes those bullet points get perceived, however sometimes, but like we said earlier, till you actually read an order and get down through it. I mean, as the health officer, I mean, how do you handle that?
Well, we have relationships with every daycare in this county. And we have contact tracers that are actually specifically dedicated to daycares and schools so that we can coordinate, because we realize that for younger age school children, there is an overlap between what happens in daycares and what happens in schools. So we don't treat them as fragmented silos. We bring that
Very
together.
similar.
Correct. And I realize I don't want to get into school openings and school closures, but we have a very, very close relationship with the schools as well, because despite the schools not being open to the general student population, there's still the internet cafe children and special needs students. And so we have a very clear and well-functioning reporting system for any students, any faculty in the school, to make sure that we can try to catch anything as quickly as possible. All right. So as far as vaccinations, these are the totals for what we've received up to this point. We were receiving nothing but Moderna vaccines until this past week, and then we got one shipment of Pfizer vaccines. They come in lots of 975 vials. The Pfizers have to be handled in a much different way, so that's the vaccine that has to be stored at -70 Celsius, and it has to be reconstituted in a way that Moderna doesn't, and the number of cc's are different between the Moderna and the Pfizer. So the reason you see lower utilization of the Pfizer is that we were concerned that if we just intermingled at the same clinic, that we could end up with safety issues. And ultimately, to me, the same safety and healthcare standards apply at our health department as applied when I was in private practice. That just like I wanted to make sure that every one of my patients was taken care of properly, we have the same responsibility to every citizen who comes in to get any kind of health care through the health department, including vaccinations. So we were told that the Pfizer vaccines were going to be a one-time allotment, and what we decided to do was isolate the clinics that we were using Pfizer, so there was no intermingling, and we will finish up the remaining Pfizers this week. So if anybody looks at it and said you only used half, that was deliberate, and they will be used this week. The Moderna vaccines, we had a few left over, so we've administered 95% of the Moderna vaccines that we have received. So where are the vaccines taking place? Well, lots of places in the county. So as many people know, that our primary vaccination site is off Route 231. We have a drive-through, which has been functioning very smoothly, very efficiently. Typically, we're vaccinating 400 to 500 or more people at a clip over at that site. But we're not just vaccinating there. CVS and Walgreens were contracted through the federal government to vaccinate all of the nursing homes and assisted living facilities, maybe where they did not quite live up to their contract. So midstream, we picked up because we did not want to see any preventable outbreaks at any of those centers. So some of our staff and resources got diverted over to vaccinating at nursing homes and assisted living facilities. The only assisted living facilities left in the county that have not been vaccinated are two very small ones. There's just been a little bit of coordination struggles there, but they will be taken care of this week. We also, there are people identified through the county's Office on Aging that have severe mobility problems. So we have nurses who are now going out to homes to make sure that those people get vaccinated. Obviously, time intensive and staff intensive, but very high risk people. Senior centers, and I'm not sure if Jennifer Moreland will mention, but we've been partnering with the Office on Aging, Jennifer's division, and Department of Transportation to try to coordinate. Oftentimes the easiest, because again, for many seniors, they can't just hop in their car and go driving everywhere. So we have partnered with the hospital to help us do outreach and set up clinic sites at senior centers or at senior living communities so that we can vaccinate oftentimes several hundred people in a few hour period and have that done. And then dialysis centers, another very high-risk group. So our nurses have been going out to the county's dialysis centers and making sure that both the staff and the people who come in for dialysis services are vaccinated. And then we also have started both with daycare and school-based. Daycare people are coming to our vaccination center. School-based we're doing at Calvert High School, so that we can again make sure that it's a good use of resources. And we've been partnering with the school nurses throughout. They've helped us with vaccinations at our vaccination site, and because they were well trained there, then we're able to make really efficient use of our staffing to set up at Calvert High School to help with that vaccination. And then percentages of the population who are vaccinated. So this is as of, I guess when I made up the slides, were 1 or 2 days ago. So our county, 9.4%, and this is through the state's figures as we report in through the reporting system, 9.4% of our county's population. St. Mary's also is doing extremely good job. The average across the state, as I mentioned earlier, 7% of the population has been vaccinated. So, you know, we're doing a good job staying ahead of the curve at this point. And truly, the biggest holdup is the supply of vaccine. And we know that there are many people, thousands of people in this county who would like to be vaccinated today. And we would very much like to be able to vaccinate them. The problem is that our allocations are, and this goes for every health department across the state, not what we want it to be. Our allocation for this week that we're in got cut by 2/3, and those vaccines are going to pharmacies like CVS and Rite Aid and Giant and Safeway. At the moment, as far as I know, there's only one pharmacy in Calvert that has received any vaccines. And then the state is now diverting, I'm not sure how many, but they're diverting vaccines to mass vaccination sites, which are opening this week at Six Flags and the Baltimore Convention Center. Within the next 2 weeks, the state is looking at opening more mass vaccination sites at the Ravens Stadium in Baltimore, possibly in Charles County at their minor league stadium, although that's not set yet. One site over in Wycomico on the Eastern Shore, and possibly one site in Hagerstown. Those are the tentatives. The presumption is that at the point there will not be a bigger supply from the federal government, and so it's likely that more vaccines will be diverted from the allocations to local health departments.
So, Doc, when it goes out to private industry like that, are they working off the same list that you have, or is it a
No.
first come, first serve?
It's a first. So what we've been told at this point is that anyone in categories 1A, 1B, or 1C will be equally eligible. And so I have, along with all of my colleagues, have voiced extreme concern up to state level that, and I'll use one example, that a 19-year-old working part-time at a grocery store who was 1C will now have the same ability to register for an appointment that somebody with severe heart disease and other medical conditions.
Right. Like I'm 52 and knock on wood, decent health. There's people that need it before me.
And there are people who they don't have internet access. I mean, certainly the school situation has brought that out, not only in Calvert, but all across the state. There are people who have mild to moderate dementia and are not going to be able to essentially fight for a spot. And so to me, this is not the ideal from a public health standpoint. This is not the best way to approach things. And again, all I can say is that it's not just me, but all of my colleagues, all the health officers across the state have.
Because these private companies aren't paying for the vaccine, correct? I mean, the only financial stake in the game they could say is we're using our employees.
I'm honestly not sure what the business side of things are. My understanding is that the federal government is purchasing these vaccines. Right. Pharmacies can charge, I think, for an administration fee, meaning that they can charge a certain amount to actually, inject the vaccine in. Our health department does not do that. But otherwise, I'm not sure the vaccine itself, that there would be any profit motive.
Right. Obviously, you know where I'm going, and I agree with you. I mean, it's tax dollars being spent to purchase these vaccines. The list ought to be the list. I mean, it shouldn't be circumvented to first come, first serve, because, no disrespect to anybody, but
preaching to the choir.
Yeah. So is that making any headway? 24 jurisdictions.
Well, and you've seen how quickly and unpredictably things have changed, at upper levels throughout well, throughout, since last February, March, much less with the vaccines themselves. So what decisions may come down tomorrow or next week, I can't predict any better than anyone else.
So, Mike, every Thursday there's a statewide COVID call from the governor's office for county leaders. So last Thursday I participated because of what Dr. Polsky had been telling us and what you see. Every day the governor's on TV expanding eligibility and opening up mass centers. And there were 8 or 9 other counties on there, and we all expressed our frustration of how the state is creating all this frustration for the counties and citizens. Because they hear the governor and they think they can go get a shot tomorrow.
Right.
We were told that the reason they were starting these private contractors out now was a pilot, because when dosages become more readily available, they figure they're going to need those facilities to help get the dosage out. Our argument was that we can't even get through phase 1 with the doses we have, and now they're taking our doses and distributing them, just like you said, to private vendors who are not going to follow our protocols. They're just going to take them first come, first serve. So that's going to create more issues in the community of why 19-year-old Johnny got a shot,
it,
and my
someone with
85-year-old grandmother can't get a shot. And it's just making a situation that's already complicated much worse. They said they heard us. We'll see if that translates into any action.
So right now, for every vaccine that's been made available, there are 6 people who've been deemed eligible. So 5 out of every 6 people who feel like they are now should be prioritized. There's no vaccine for them at the moment.
Because our argument was, if you get to enough dosages where you can get down to phase 3 or 4, then open it up.
Sure.
Let me walk in giant and get one, but not today.
Right.
When we can't get enough to get through essentials that we need to get through, don't be taking our doses.
I agree.
But it's too late. That horse is out of the gate. We'll see.
Well, what we got before us is just focus on delivery of what we got. That's the main issue.
Yep.
And that we are absolutely doing our best to make sure our expectation based on what we have set up this week is that we will have no more than, we should have 0 left at the end of this week, which has happened several other weeks. And one week where when it was clear that CVS was not going to vaccinate one of our nursing homes and we wanted to go over there, we didn't have enough vaccines on hand. We borrowed vaccines from the hospital, who was still in the process of vaccinating their staff, until we could get more from MDH next week to pay them back. So my expectation is, the vaccines we have right now, again, we will make sure they are all administered before the week is finished, and then we'll see what next week brings. And that's the other, for people to understand, that we don't find out how many vaccines we're getting for the next week until the weekend. So it's generally, and oftentimes Saturday night, one time Sunday morning, before I knew what we were going to get on Monday. And so planning and staffing become extremely difficult. And the last thing we want to do is sign somebody up for a vaccine and then have to pull it away from them because we don't get enough doses. So we're left every week with a bit of a mad scramble last part of the weekend and first thing Monday morning to make sure we're setting all these things up, getting staffing appropriate, getting people registered properly. So it's been a chore.
So we have a registry, so we still want to encourage people to register. I don't know what the number is up to now. The last time I saw was 25,000 we had registered. So we still encourage citizens, as frustrating as it is, please register, so at least we have you on the list.
And everyone should be aware that we are absolutely doing our best to make sure that we get people prioritized and get people in as quickly as we can.
Yep.
All right.
Well, thank you, Dr. Polsky.
Thank you.
We appreciate your
Thanks, Doc.
efforts.
Thank you all.